Welcome to the Community Outreach Talk Show. It is a collaborative initiative designed to empower families and community members with essential knowledge and skills to ensure child safety and well-being.
In the first segment, practical first aid techniques for burns, cuts, and choking will be demonstrated, along with proper mask use and hygiene. The second segment focuses on creating safe physical environments by examining health risks, sanitation issues, and strategies for safety in preschools. The final segment focuses on child abuse prevention through a case study analysis, exploring causes, effects, and cultural perspectives on maintaining a safe social environment.
Go. The first thing on our agenda is what is first aid? The first assistance given to a person experiencing a medical emergency is known as first aid. It is typically given at the scene of the accident and as soon as possible after it happens, according to Helper 2018. When it comes to treating a first-degree burn, the first thing you're going to do is remove all tight clothing or jewelry. The next step, you're going to put the affected area under running water for about 10 minutes or until the pain moves out. Or you can also put a damp cloth on the affected area.
Now, when a child comes to you with a small cut that's bleeding, this is how you censor it. First, you calm the child. It's okay. You're going to be okay. I'm going to clean it and put a bandage on it. Okay? All right. Next, you need to sanitize your hand by washing it.
You always press my full hand on my leg.
It's good to engage in talking with them to keep them calm. Okay? Next, I will dry my hands. Okay? Now, I'm going to stop the bleeding. Now, you can use a cloth or a clean tissue. Apply a gentle pressure on the cut for a few minutes. You can ask the child to hold it. Then I'm going to wash the cut in the event there's any dirt. All right, you want to stand there or you good? You good? All right. All right. Okay. Then you're going to dry the area. You can use a clean tissue. However, it's advised to use a cloth. Okay? Alright, so I'm going to further clean the area. There you go. Alright, you discard. And then you would apply some form of antibiotic powder. I have BNC powder, which I will apply now. Alright, so I'm going to apply a little bit of this, okay? Keep the hand like that. Alright. Next, you would apply a bandage. I have a small plaster since it's a small cut. Be careful not to touch the padded area. And then you apply, gently apply. And there you have it, how to clean a bleeding cut that's small in size.
We'll be demonstrating how to properly wear and dispose of the mask. So first we need to ensure that your hands are washed properly with soap. So you wash your hands. Then you dry them. Ensure that you dispose of the tissue. Then you get your mask. First thing you want to do is examine your mask, make sure that it is not damaged or dirty. Then you hold the strings of the mask and you place it behind your ear. After which you would fix it to fit your face, make sure that your nose is covered, your mouth is covered. Now to dispose of it, you remove the strings from your ear. Without touching the mask, you would fold it, place it in a plastic bag, and then dispose of the plastic bag.
Now the first infectious disease that I'm going to look at is human immunodeficiency virus, HIV. HIV weakens the immune system, making individuals more vulnerable to infections. If a pregnant woman has HIV, there is a risk of the virus passing on to the child during pregnancy,
childbirth or breastfeeding. Without treatment, HIV in newborns can result in failure to thrive, inadequate growth and development, immune deficiencies, making the child more susceptible to infections, neurological issues such as developmental delays, and cognitive impairments. I'm also going to look at syphilis. Syphilis is a sexually transmitted bacterial infection caused by Treponema pallidum. This is the name of the bacteria. It can have serious consequences if transmitted from a pregnant woman to her fetus. If untreated, syphilis can cross the placenta and infect the fetus, especially in the early stages of pregnancy. The effects on the developing child include congenital syphilis, which can cause stillbirth in severe cases, deformities of the bones, teeth, and cartilage, neurological complications such as intellectual disabilities and seizures, vision and hearing impairment, liver and spleen enlargement. Syphilis screening during pregnancy is essential, as early detection and antibiotic treatment can prevent transmission to the baby. Now, prenatal care is very important. Prenatal care is crucial for early detection, prevention, and management of infectious diseases. It enables screening and monitoring for infections like HIV, allowing timely intervention. Education and preventative measures include lifestyle adjustments to reduce risk, access to medication and treatment, such as ART for HIV to protect the fetus and manage maternal health. Overall, regular prenatal visits provide essential support, guidance, and medical interventions that can dramatically reduce the risk of complications, ensuring healthier outcomes for both mother and baby.
Now we will jump into looking at how poor water quality and poor air quality affects productivity among adults and children. Access to clean water and air is vital for maintaining health and productivity. However, poor sanitation such as contaminated water or polluted air can negatively impact people's well-being and hinder their ability to function effectively. Many individuals face significant risk due to improper or poor sanitation, leading to poor performance in schools, workplaces, and the community. This section examines how poor water and air quality affect health and productivity, highlighting the impact of smoking and vaping on both adults and young children. Water is one of the basic needs necessary for sustaining health and supporting productivity. Yet many people face problems of water contamination due to improper waste disposal, industrial waste, agricultural runoff, and poor sewage management. Contaminated water can lead to many illnesses, including cholera and hepatitis. These diseases are extremely detrimental to children, whose developing immune systems make them vulnerable to severe symptoms, often resulting in malnutrition and developmental delays, according to the Centers for Disease Control and Prevention 2019. Regarding adults, frequent illness due to waterborne diseases hinders their ability to work consistently and effectively, while children suffering recurrent infections are more likely to fall behind academically due to being sick and having to miss school. This drop in productivity among both adults and children extends beyond the individual themselves to affect the community they live in, where healthcare costs rise to cover medications and treatments for those affected by waterborne illnesses. Also, the educational system suffers. Students who miss school due to illness fall behind on lessons covered during their absence, which can lead to poor academic performance and setbacks in their learning process. We'll now discuss how poor air quality affects health and productivity among adults and children. Air pollution is one of the greatest environmental risks to children, according to World Health Organization 2023. There are many contributors to air pollution, such as outdoor sources like exhaust from vehicles and emissions from factories, to indoor contributors such as poor ventilation, directly harming the respiratory system. Pollutants such as sulfur dioxide and nitrogen oxides can cause long-term respiratory problems, heart diseases, and even early deaths. Poor air quality affects children. The inhaling of polluted air can affect their growth and development. For instance, they can develop health conditions such as asthma, which affects their physical and cognitive development. Poor air quality affects children in various ways. Inhaling of polluted air can interfere with their growth and development, leading to health conditions such as asthma. These conditions not only impact physical health, but can also hinder cognitive development. Studies have shown that when a child is deprived of oxygen, it can impair cognitive abilities such as memory and attention. Furthermore, poor air quality significantly affects adults in the workplace, especially those suffering from respiratory conditions such as asthma or bronchitis. These workers often have trouble focusing, fatigue, and reduced energy levels, all of which contributes to decreased productivity. Additionally, employees working in poorly ventilated environments are at a risk of developing respiratory illness over time, further hindering their ability to perform tasks effectively. We will now take a look at the effect of vaping on adults. Smoking releases many toxic chemicals into the atmosphere, such as carbon monoxide, which increases the risk of lung cancer, heart disease, and stroke. Vaping is a modern-day form of smoking. It is where you use a handheld electronic device issues, trouble focusing, and absentees from work, all of which contributes to low overall performance and productivity. Vaping doesn't just impact adults, it also poses serious health risks to young children through secondhand smoking. Research conducted reveals that children exposed to secondhand vapor from e-cigarettes are more likely to develop respiratory illnesses like bronchitis and asthma. This can lead to them being absent from school, to not feeling well, and developmental delays to frequent hospital visits. Additionally, the chemicals in vape, such as nicotine, negatively affect brain development in young children, potentially impacting their memory, attention, and learning abilities. These health challenges hinder children's academic performance and social development, affecting their potential for the future.
Now I will be discussing 3 ways on how to create a safe preschool environment from all stakeholders. 1. Emergency preparedness. Preschool should have a complete emergency plan in case of any fires, lockdown, medical emergencies. There should be regular drills and training for employees so that everyone knows what to do. Teachers should be trained in first aid and CPR because they are vital too. 2. Age-appropriate design. The preschool should be laid out and according to the age and the ability of young children. Preschool furniture should be age-appropriate to make the place comfortable and inviting for preschoolers. Seats and tables should be balanced so that the children can sit comfortably. Furniture should be constructed from durable, easy-to-clean wood, plastic, and laminated to encourage the independence of discovery and the neatness. 3. Hazard monitoring. Teachers must check spaces, both inside and outside, frequently for furniture fragments, sharp objects, and surfaces. Any play equipment you use should be appropriate for children and clean.
As a group, we analyzed the case study of a child who we suspected is being abused. Based on the case study, the act of causing another person physical pain and bodily harm is known as physical abuse. Serious abuse might cause injuries that could lead to death or permanent disability. Additionally, the victim may suffer from psychological and emotional problems such as anxiety, fear, humiliation, despair, trauma, and trouble trusting people. Examples from the case: infant cries when the right arm is being touched, swelling near the wrist of the right arm, marked tenderness when the forearm is touched, and he has bruises on his buttocks. Death occurs when a caretaker fails to provide for a dependent person's fundamental physical and emotional requirements such as food, clothing, shelter, medical attention, and emotional support. Now some examples from the case: delayed medical attention and falling behind on immunizations and lack of recent clinic visits. Other ways in which physical abuse can be inflicted on a child. Number 1. When a baby or toddler is shaken violently, it can cause severe brain damage known as shaken baby syndrome. Number 2. Burns or scalds. Intentional burns are a severe kind of physical abuse, such as when a child is submerged in hot water or has a hot object pressed against their skin. These burns frequently exhibit distinct patterns, such as well-defined lines from immersion burns that can be distinguished between unintentional and intentional damage. Neglect can also be inflicted in 2 different ways. Number 1. Lack of proper nutrition. Growth delays or malnutrition may result from inadequate or inappropriate food provision. In extreme situations, a child may show symptoms of poor physical development, weight loss, and increased vulnerability to disease. Chronic malnutrition can have long-term effects on social and cognitive development, in addition to physical health. Physical abuse may have both short-term and long-term effects. So for the short-term effects, we have number 1, physical injuries. These may include burns, fractures, bruises, and internal injuries that need to be treated right once. Number 2, behavioral changes. As a result of their experiences, victims may display aggressive behavior, hypervigilance, fear, or worry. Number 3, emotional distress. Common responses include short-term anxiety, depression, and social disengagement. Long-term effects of physical abuse include chronic health issues. Physical abuse that occurs repeatedly can cause long-term harm, including neurological disorders, persistent pain, and disability. Number 2, mental health disease. PTSD, sadness, and anxiety, and substance use disorders are among the conditions that survivors are more likely to experience. Number 3, relationship issues. Adults and survivors may display aggressive tendencies or become unruly, obedient to authority, and they frequently find it difficult to build wholesome, trustworthy relationships. Neglect can also have both short-term and long-term effects. So the short-term effects for neglect include number 1, health problems and malnutrition. Insufficient food, shelter, or medical attention can impair immune systems and cause growth and developmental milestones to be delayed. Number 2, educational and cognitive delays. Because of insufficient stimulation or malnutrition, neglected children frequently struggle academically, have trouble focusing, and have trouble learning. Number 3, social and emotional difficulties. Children who experience neglect frequently feel alone and unsupported, which can result in behavioral problems, emotional detachment, or social disengagement. The long-term effects of neglect include number 1, impaired emotional regulation. Neglect can cause problems with emotional control that last a lifetime and frequently lead to increased stress reactions, anxiety, and depression. Number 2, substance misuse and risky behavior.
Factors that can contribute to the occurrence of physical abuse and neglect. 1. Socioeconomic stress. Poverty and financial hardship are strongly associated with a high likelihood of child abuse and neglect. High levels of stress can result in irritation and unfavorable interactions with children in families with low resources, particularly in cases of extended difficulty. This financial strain may make parents less emotionally available and patient, which raises the possibility of both physical abuse and neglect. Research shows that because of the compounding effects of stress on family dynamics, economic insecurity frequently corresponds with increased rates of abuse. 2. Mental health issues in parents. Mental health conditions such as substance misuse, depression, or anxiety in caregivers might impair their capacity to regulate their impulses and deliver appropriate care. Parents who struggle to manage their frustration due to untreated mental health conditions may act neglectfully or abusively towards their children. Untreated parental mental issues raise children's risk because they frequently make it more difficult for caregivers to react to the needs and stress of their child. And lastly, abuse patterns across generations. Adults who experience abuse or neglect as children are statistically more likely to behave similarly towards their children, which feeds the cycle of abuse. Unresolved trauma and ingrained behaviors are the causes of this generational abuse. Research highlights how childhood exposure to abuse or neglect can normalize these behaviors, making them more likely to appear in adults' interactions with their children. To prevent child abuse, caregivers can adopt several proactive strategies that foster safe, supportive, and enriching environments for children. Firstly, encouraging positive parenting skills. Learning positive parenting strategies such as stress management, constructive discipline, and open communication is beneficial for caregivers. For instance, the American Psychological Association program gives parents a tool they need to establish a positive relationship with their children and provide a safe, caring environment free from threat and abuse. 2. Enhance community support and supervision. Risk can be considerably decreased by being aware of who is watching over children and making an effort to get in touch with local child welfare organizations or support groups. To help parents understand child development and create a safe home environment program like Parents as Teachers offer home visits and community links. To lessen caregivers' isolation, which may be a contributing factor to abuse, these programs also emphasize creating a network of community support. And lastly, resources and high-quality childcare. Parental stress is frequently aggravated by financial strains and a shortage of reasonably priced childcare, which can lead to abusive circumstances. Some of these stressors can be reduced by guaranteeing access to high-quality, reasonably priced daycare and financial support networks. As advised by the CDC, flexible work schedule and paid family leave are two policies that help parents manage their duties without using severe disciplinary actions. A theoretical perspective that highlights how important culture is in a child's development is Vygotsky's socio-cultural theory. Vygotsky's social development theory asserts that a child's cognitive development and learning ability can be guided and mediated by their social interactions. His theory states that learning is a crucial social process as opposed to an independent journey of discovery. He expands on this by stating that a child's learning benefited greatly from being guided by a more knowledgeable community member. Vygotsky's social theory also suggests that children internalize and learn from their beliefs and attitude that they witness around them. He believed that culture plays an important role in shaping cognitive development, and therefore this development varies across culture. Vygotsky also stressed the importance of language as the root of all learning.